Meet Cyclospora. It is a microscopic gastrointestinal parasite that typically causes a mild, manageable surge of stomach bugs every summer. This line graph tracks summer Cyclospora cases in Michigan over the last decade. Historically, the baseline is low, hovering around just 50 confirmed cases a year. Under normal conditions, this pathogen is an invisible nuisance. It causes a few isolated illnesses, and our standard public health infrastructure absorbs and manages the cases without needing a specialized response. But in the summer of 2026, that baseline disappears. Looking at the far right of the graph, the number of confirmed cases in Michigan alone rockets past 8,000. The scope expanded to the national level, with 41 states reporting thousands of confirmed cases and an estimated 7,000 unconfirmed infections flooding hospitals and clinics. At the federal level, the regulatory response was marked by confusion. The FDA initially traced the parasite to iceberg lettuce from Taylor Farms in Mexico, triggering widespread corporate recalls, only to retract the claim days later as a false positive. How did a familiar, previously manageable organism completely bypass our national defenses and trigger the largest outbreak on record? Unlike many viruses, Cyclospora has a biological requirement for heat. After leaving a human host, the parasite needs a specific window of warm, humid conditions to mature and actually become infectious. The summer heat waves of 2026 provided those conditions on a massive scale. Instead of sitting dormant, the parasites were provided with the exact environment required to mature within the agricultural supply chain before reaching grocery stores. These temperatures also increased the medical danger. Cyclospora causes weeks of severe, watery diarrhea, a symptom that leads to rapid dehydration when outdoor temperatures are consistently hitting record highs. The 2026 heat waves didn't just speed up growth. They activated the parasite's infectivity across thousands of square miles of farmland, providing the specific laboratory conditions the pathogen needs to thrive. Just as this environmental pressure peaked, the country's defense mechanisms were gutted. In 2025, the Trump administration slashed $12 billion from federal public health funding and eliminated 80% of the CDC's leadership. The CDC's Division of Parasitic Diseases was disbanded, and its Cyclospora lab dropped from 11 experts to 3. Simultaneously, FoodNet's mandatory tracking mandate was slashed from 8 foodborne pathogens down to just 2, Salmonella and E. coli. This massive outbreak occurred because the federal early warning systems designed to detect and stop it were intentionally turned off. Stopping a foodborne parasite is a logistical challenge. Cyclospora can incubate in the human body for up to 2 weeks before symptoms appear, leaving patients unable to accurately recall what they ate or where they shopped weeks earlier. Linking a specific infection to a specific farm requires cross-referencing patient receipts with thousands of shifting logistics manifests from international distributors. That scale of investigative work requires a national command center. Without federal coordination, the FDA is forced to rely on flawed data that leads to false recalls, leaving local departments to sort through a massive backlog of unverified leads. Without a centralized, well-funded federal investigative team, stopping a massive multi-state outbreak rapidly devolves into fragmented, unreliable local guesswork. The 2026 Cyclospora outbreak is the result of rising environmental pressures colliding directly with defunded public infrastructure. Lacking federal guidance, local scientists are being forced to innovate. Researchers at Michigan State University are currently adapting wastewater testing procedures to hunt for the parasite in the sewage system, trying to gauge community spread before more hospital rooms fill up. These efforts are taking place while extreme heat simultaneously pushes other critical defense layers, like the power grid, to the brink of failure. When the environment becomes this unstable, the network that tracks these outbreaks is the only thing standing between a few isolated cases and a nationwide emergency. Until those federal tracking systems are fully restored, the burden of disease prevention is pushed entirely onto individual consumers. For vulnerable populations, the strategy is avoidance. Health officials recommend skipping fresh prepackaged greens and opting for cooked, canned, or frozen produce instead. The parasite is killed at 158 degrees. For the general public, meticulously washing all raw produce is essential. And if you do fall ill, maintaining constant hydration is critical to surviving the compounding risks of the summer heat. We cannot stop extreme weather, and we cannot see microscopic parasites. But when our systemic defenses fail, personal preparedness is the only shield we have left.